back to Harlow on Healthcare at HIMSS 2018 in Las Vegas. This is David Harlow, and I'm talking with Simon Beulah, Senior Director of Healthcare at Linguamatics.
Thank you, David.
Simon, welcome. Good to meet you. So, Linguamatics, tell us, please, if you would, 25 words or less. What's the proposition?
Linguamatics is about unlocking the value that's trapped in unstructured notes. So in healthcare, it's about mining physician notes and helping identify high-risk patients.
In this day and age of drop-down menus and clicks everywhere, what proportion of the information would you say is still locked in free text?
It certainly varies between health systems. The more sophisticated ones have forced that type of structured documentation into their workflows, but I'd still say it's still 70% unstructured and 30% structured. So there's a lot of information still in the notes, and we hear a lot about physician burnout and the amount of effort it takes to look at and enter in structured information and how much time it takes up in people's days. And certainly as I've been talking to clinicians, they're saying, well, we want to get back to telling the story of the patient. That's what we're about. All this analytics should be taken and extracted by NLP so that we don't have to worry about that.
Right. I was talking with someone earlier this week about what he termed the tyranny of automation. Doctor doesn't want to click box A because the results are, if I click that, I have to look at this menu and click this menu, and I get sucked into the vortex. So is there a danger then of losing some useful information if you switch to the dictated or typed note, because you don't get the prompt from the system that says, you said this, now I need to know about that?
Yeah, I think there's always a balance, but if people aren't clicking something and entering the data because they don't want to go through all the other options, then equally you're missing out there as well. So you have to think about what's the right balance for the clinician, that they're getting the right data in and they're being helped to identify the right treatment pathways by a combination of structured and unstructured data entry.
So we assume you get this information out of the record, then what do you do with it?
Yeah, so there's a number of key applications that we find are most relevant. As we move towards value-based care, identifying high-risk individuals is really important. So we work a lot in predictive risk models, where we might be extracting social determinants of health like food insecurity, social isolation, functional status, whether there's a support system at home, for example, and that might be in a discharge summary or in an H&P or in clinical notes of some form. So we help extract those and enable those to be used within predictive models alongside the structured data. We do a lot of work in identifying individuals through a patient safety net. So an example of that would be real-time mining of radiology reports to look for pulmonary nodules as an incidental finding. So there's an ER visit, there's some acute care going on, and the radiologist identifies a pulmonary nodule. They have a responsibility to inform the physician, but then the follow-up, because of acute care, there may be something that's missed. So quite a few of the health systems we work with are doing automated analysis overnight to find those individuals that need follow-up. And this is a type of intelligence augmentation that I like more than the artificial intelligence concept. So you're empowering the care coordinators and clinicians to really take advantage of technology, focus them in on the important ones, the people who need the most help, instead of doing tons of manual chart review. Sometimes it's just not realistic to read every radiology report every night. It's just not practical.
Right. And the specific targets that you're looking at are defined by the individual customer organization?
Yeah.
Or do you have some stuff that's baked into your
No, we've got pre-built models that are looking at these types of things, so social determinants, lifestyle factors, and the predictive models, things like pulmonary nodules, PSA values, mammogram follow-up. And then we do a lot of work in quality measure reporting as well. So basically where there's a lot of manual chart review, then we're looking to reduce that. If there's a lot of noise, there's a lot of a very large data set with only a small amount of signal in there, that's where NLP is really useful.
So is the technology focused entirely on the clinical data, or there's certainly other data? You talked about sort of social related issues. Do you go beyond that? Is there an issue of dealing with payers, dealing with quality and other measures that people are looking to collect?
Right. So we're doing work with HIMSS metrics. We're looking at surgical metrics as well in terms of extracting those from the notes. And we also are working with payers on population stratification, predictive risk models for something like diabetic foot amputation or CHF populations, where again we're bringing insights from the unstructured notes, unlocking those and making them available for predictive risk modeling.
Have you been involved in any situation where someone on the other side, so to speak, is pushing back against the sort of the way in which the information is extracted and captured? For example, a payer who's being asked to pay a bonus based on meeting certain metrics. We say, well, we've identified the fact that we've hit these metrics using this tool. Do they come back and say, show us how it works? Are you serious? Or...
Yeah, I mean, whatever we do has to have an audit trail so that you can say, okay, well, this decision was made based on this information which was extracted. This is the evidence to show what we extracted, what position within that document that came from. So you have that classic audit trail so you can deal with those type of questions of why did you do this and what was the justification for it.
Mm-hmm. Right, so the logic is transparent.
It absolutely
needs
is.
to be. Okay.
Yeah, and that's one of the challenges with the machine learning algorithms is that it's somewhat black box. It's hard to see why something was derived at. We're very much a transparent, flexible platform. You can see what's happening, you can understand the logic, and that can feed into machine learning and really accelerate the development of those models. But it is a transparent, auditable process in doing that.
So you see this then, it sounds like you see this as an important step towards a machine learning environment where it is more transparent and you can gain greater confidence, perhaps, in the output.
Yeah, absolutely. And certainly with machine learning, if you can feed a consistent, well-characterized, normalized data set to those algorithms, your chances of success are significantly higher than if it's a sparse data set that's not well populated.
Mm-hmm. Okay. So we talked about sort of clinical, financial. Are there other, perhaps public health uses that you're involved in?
We've been looking at actually the use of real-world evidence to look at specific outcomes from large-scale populations. So, for example, a CHF population of 100,000 patients. What were their outcomes from having a pacemaker fitted? Is it something that's still there? What was the severity of the CHF? What was that device removed? If it was removed, why was it removed? And that's getting a lot of attention. If that was 100,000 patients and 34 million clinical notes. So it went back to 2008. It went back 3 years from any CHF diagnosis. So you could track ejection fraction over time and see what happened. And that's getting a lot of attention from groups like the FDA, who are really interested in post-market surveillance of medical devices and what are the best outcomes from drugs and devices. So it's a real transformation in the industry to see how healthcare data can be used to understand real outcomes in large populations. And that project was done in 3 months with 2 people who've never done NLP before with our platform. So that, the ability to onboard quickly, get value quickly is obviously very important within a healthcare environment.
Well, great. That's an exciting story, and I'm glad to hear it from you. Thank you very much.
Thank you.
This is David Harlow, connecting at HIMSS 2018.